On completion of this module, you will understand to appreciate the importance of systematic, holistic assessment of the person with a wound, to recognize the importance of tailoring wound management to the individual patient and their wound, according to assessment findings, to understand the new M.O.I.S.T concept, why it was developed and how it can help to structure your wound care decisions in daily clinical practice. To remember that M.O.I.S.T is an acronym that represents key areas of the wound for consideration during both assessment and management. At the end of the module, you can take a short test to check your understanding of the module's contents and reflect on what you have learned. Class is in session, or at least it's supposed to be. It looks like our professor for the day isn't in yet. But as you can see, our team is all in attendance and just brimming with energy and raring to go. Because if there's one thing our team knows, it's that there's always room to learn more when it comes to wounds and wound healing. Hold on, what's that? Someone's just entered the classroom. Ah, there they are. The professor is in the building. Look alive, team. Perfect. You'd think they were sitting like angels the whole time. So, with a new professor comes a new lesson. So what's on the agenda today? The M.O.I.S.T concept. That's a new one, and it looks like the team are all eyes and ears. Impressive leap, by the way, Prof. Textbook time. With a quick preview of what we're about to learn about, which is assessment and management of patients with hard-to-heal wounds and why it's important. Assessment should consider the patient's general health alongside wound factors, including cause, dimension, location, and duration. Tissues present within and around the wound should be identified, and blood flow and oxygenation considered. Signs and symptoms of infection or biofilm, such as exudate volume, pain, and odor, should also be monitored to aid identification. Remember that from Module 2, Wound Exudate? Without acquiring the knowledge and skills it takes to properly assess and then manage a patient with a wound, it won't heal optimally or properly and could lead to further complications beyond delayed healing. Looks like the professor has something new on the board. Oh, it's a reminder of what we've already studied: wound healing, wound exudate, and wound infection. All three of those lessons have implications that will factor into today's lesson. Today's lesson, M.O.I.S.T, isn't the first concept for topical treatment of chronic wounds. There have been others before, and knowing about them can help in our lesson today. For example, TIME, which stands for Tissue, Infection, Moisture, and Edge, is widely used as it is a reminder of what we need to address to promote wound healing. But if you think of wound healing like a formula, there's always room to change the equation but come up with the same answer. That's what M.O.I.S.T is. A new framework or equation. M.O.I.S.T takes this further. It still considers moisture, tissue, and infection, but also adds in oxygen and support for the wound. M plus O plus I plus S plus T equals M.O.I.S.T. The M.O.I.S.T concept has been designed to support physicians in systematically planning topical treatment of hard-to-heal wounds using the most recent scientific advances. M.O.I.S.T is an evolution of the TIME concept and other concepts like it that came before. It still applies and slightly modifies the T, I, and M from TIME, but new letters have been added to allow for other treatment options. It would be easy to just slot in a short lecture on the new letters, O and S, and call it a day, but oh no. Professor isn't here to just lecture, he's here to add a little razzle, dazzle, and flair to the lesson, because that's how he likes to get down. So, who's ready for a show? Ladies and gentlemen, molecules of all shapes and sizes. Red blood cells and white blood cells alike. Are you ready to learn? Ready to meet and greet the new and improved, the bigger and better, the most electrifying support team in wound assessment and management the human body has ever seen. First, coming to the wound care arena, weighing in at an undisclosed number of pounds, the letter known as Big M around these parts, meet moisture balance. Big M knows that too much or too little exudate can delay wound healing. So he needs to ensure moisture is well balanced by selecting appropriate treatments. Is that wound too dry? Big M knows it's time to use a wound gel to add that much needed moisture. Too wet? Well, he breaks out one of his favourite moves. A dressing that has good total exudate management, a combination of absorption, retention and evaporation. Because Big M knows that when he picks that right dressing for the right wound, he can efficiently prevent the exudate from pooling, prevent maceration, supporting a clean wound bed until that wound is down for the count. Examples of dressings that can handle different amounts of exudate include alginates, gelling fibre, foams and superabsorbent dressings.
Wound exudate is essential for wound healing, since it brings nutrition, growth factors and other essential healing components to the local wound. Exudate also moistens any devitalized tissue or debris in the wound, promoting its removal through autolytic debridement, which is one central key if healing is to take place. The moist environment created by exudate also reduces pain and encourages faster healing. It is recognized that moist wounds heal 2 to 3 times more quickly than dry wounds. However, exudate in the wrong amount, place or composition can delay healing. Several factors can influence the amount of exudate a wound will produce, such as its type, size and location. The phase of healing can also affect exudate production. As healing occurs, less exudate is produced. If a wound has become chronic or hard to heal, there can be an imbalance in the composition of the exudate, and that can result in tissue destruction rather than healing. For each individual with a wound, treatment should be aimed to achieve moisture balance to encourage healing. This can be done by selecting an appropriate wound dressing or device for the condition of the individual and their wound to create a perfect moist wound healing environment. This may involve using a dressing to add moisture or remove it. Other factors that may influence exudate production, such as the presence of infection or an underlying disease, should also be addressed to optimize healing.
Next up, say hello to oxygen balance. OxyB wants to ensure that there's a good supply of oxygenated blood to the wound, as that is an essential component of the wound healing process. So how does OxyB do this? Well, she's got a few tricks up her sleeve. The easiest way to deliver oxygen locally to the wound bed is by using topical oxygen therapies, including application direct to the wound. For example, by using a hemoglobin spray. Hemoglobin sprays can assist in helping oxygen from the atmosphere to reach the wound bed, but can also help prevent the buildup of slough, as well as reducing pain. Now that's what I call a finishing move.
Hypoxia is a common cause for poor healing in chronic wounds. Oxygen is needed during wound healing because of the increased demand for reparative processes such as cell proliferation, bacterial defense, angiogenesis, and collagen synthesis. Conditions such as small or large blood vessel diseases, ischemia, edema, and infection can all impact on the delivery of oxygen. Topical oxygen can be applied to the wound using different technologies. For example, when a hemoglobin spray is used. Hemoglobin is sprayed into the wound where it binds with oxygen and facilitates diffusion through exudate, supplying the base of the wound with oxygen. A systemic review carried out by Hu et al. From 2020 found that hemoglobin spray could substantially reduce the quantity of slough in the variety of wounds. It can relieve the pain, it's simple to use in any settings and could be used by patients in supported self-care settings. The advantages of hemoglobin sprays are that unlike other oxygen delivery technologies, it is designed to allow oxygen to diffuse through the wound exudate. It can also be used in various settings without costly consumably or extras.
Now this is infection control, or as he likes to be called, Dr. IC. An infected wound can not only cause severe delays in the wound healing process, but it can also really affect the patient's quality of life, cause pain, odours, and increase exudate. So that's why the grappler known as infection control needs to grab a hold of and manage the risk of infections. After identifying the factors that could contribute to infection, establishing the best way to care for and treat them, and developing a prevention and treatment plan, it's time for Dr. IC to get to work to reduce local bioburden. Systemic antibiotics should only be used when the patient has a spreading or systemic infection, and it can preferably be combined with local antimicrobial treatment. Antimicrobial agents can be applied directly to the wound to reduce the number of microorganisms present in the wound when infection or biofilm is present, or where the patient is at an increased risk of infection. Infection control is in complete control.
The Wound Infection Continuum from the International Wound Infection Institute provides a framework to assess the impact microorganisms are having on the hosts. The continuum describes the signs and symptoms commonly seen as infection develops. Regular assessment can help prevent infection, and early intervention may stop problems from escalating. A wound infection prevention and management plan aims to optimize the individual host response. For example, optimize any comorbidities such as diabetes, reduce local microbial burden, for example with topical antiseptics or antimicrobial dressings, and promote a positive wound healing environment. For example, with a clean environment and psychological support. Reducing local microbial burden can be achieved using two principal local treatment options. Antimicrobial agents such as silver, polyxonite, hypochlorous acid, honey can be used to either kill or inhibit microorganisms. Dressings that absorb, bind and retain microorganisms, such as bacterial binding dressings, absorbent cellulose fibers and superabsorbent polymer dressings, can be used to physically remove them from the wound. In addition, non-medicated wound dressings, such as megatherapy, provide a viable alternative to the active antimicrobial agents. As part of the so-called antibiotic stewardship concept, it is recommended to reduce the use of antibiotics. Locally applied antibiotics are mostly not necessary in wound treatment, and systemic antibiotics are used cautiously.
Next up is Mrs. S. Support, which is all about strategies that support the wound bed. Wound healing is made up of a complex chain of events that often overlap hemostasis, inflammation, proliferation, and maturation. In some cases, the wound will not heal despite apparently adequate treatment. For example, excessive matrix metalloproteinases, MMPs, an altered pH out-of-control pro-inflammatory mediators, and a lack of growth factors or collagen. In this situation, specific wound therapies may be used that actively affect the impaired wound healing process. Hard-to-heal or chronic wounds can either fail to go through the normal chain of events or get stuck in the inflammatory phase. And that's where support comes in, making sure things are happening when and how they should. In this stuck or unbalanced state, Mrs. S is required to kickstart the chain of events and get the wound healing. Strategies that can be used include altering the wound's pH, reducing inflammation, and managing excess exudate and MMP imbalance appropriately. Different dressings can be used to support these strategies. For example, superabsorbent dressing and negative pressure wound therapy can be used to manage excess volumes of exudate, while collagen dressings can be used to restore MMP balance.
Wound bed pH has been shown to be important in wound healing. It helps control infection, increases antimicrobial activity, oxygen release, angiogenesis, protease activity and bacterial toxicity. The pH environment in chronic wound has been reported with the range of 7.1 to 8.9. The targeted change of the pH value can help to support wound healing. Acute inflammation is a normal, healthy immune system response characterized by local redness, heat, swelling, and pain, and resolves once the cellular debris and foreign materials have been removed. It is an essential stage of wound healing as it re-establishes hemostasis in preparation for tissue repair. Chronic inflammation is mostly an unhealthy and persistent immune response that results in an unabated change in tissue cellular composition and delayed healing. The early detection and treatment of excessive inflammation in wound is important in reducing tissue damage and encouraging wound healing. In hard-to-heal wounds that are not progressing, chronic inflammation and high level of matrix metalloproteinases can destroy collagen and many other important components of physiological wound healing. Therefore, a treatment option is to replace the collagen to inhibit the activity of matrix metalloproteinases, which re-establish hemostasis. It is important that wound debridement is achieved first, otherwise this dressing cannot interact with the wound bed.
And finally, tissue management. T understands that when it's all said and done, an uncleaned wound is a wound that won't heal properly, and that when it comes to cleansing and debridement, there's only one person for the job. Cleansing is key before and after debridement for both the wound and the surrounding skin. Cleaning or removing the slough, necrosis, hematomas, eschar, debris, foreign bodies or infected tissue from the surface of wounds as it provides a physical barrier to healing. This can be done in several ways. For example, including the use of surgical and hydrosurgical debridement or sharp debridement, but these can require access to qualified clinicians and/or equipment. More commonly used is autolytic debridement, the body's own process in which it removes dead and devitalized tissue. This process can be helped along using debridement pads or cloths, or dressings which help to moisten, absorb and remove dead tissue from the wound bed.
The presence of devitalized tissue can cause malodor, an increased volume of exudate, increase the risk of inflammation and infection, and generally reduce the patient's quality of life. Debridement is a foundation of wound healing and involves the removal of slough, necrosis, hematomas, eschar, debris, foreign bodies, infected tissues that accumulate on the surface of chronic wounds. Cleansing and preparing the wound bed can be achieved through different types of therapeutic methods. It may be necessary to use more than one approach, for example, rehydration of hard black eschar with autolytic debridement before sharp or mechanical debridement. However, debridement should only proceed once the wound has been identified as non-ischemic. Since people with ischemic wounds, debridement may result in further tissue death, and therefore revascularization should be performed first. Early and appropriate cleansing and debridement are central important parts of optimal wound management. It should be performed frequently on an ongoing basis depending on the type and amount of devitalized tissue present.
So there we have it. These new partners are here to support you. And with that, our lecture has come to an end. Who knew class could be this electrifying and informative? And you thought this was going to be just another lesson. Good job, Prof. Now we know that a structured approach to topical assessment and treatment of a chronic wound isn't as easy as 1, 2, 3, but as easy as M.O.I.S.T. Moisture balance, oxygen balance, infection control, supporting the wound bed and tissue management. And from how pumped the team are, and Prof, it looks like they can't wait to hop into the ring with their new tag team partners and handle anything a wound can throw at them.